Welcome to the Monash Health 2021 Lengths of Service Awards. Congratulations to all our employees and volunteers who have achieved significant career milestones this year. This year we recognise over 1,500 people who have made a lengthy and meaningful contribution to Monash Health, and tonight we focus on our 20 and 25-year volunteers and employees. And importantly, I really want to just say thank you for all you've done for Monash Health. In a remarkable achievement, we have two people who have reached milestone years of 55 years of service. I'll have more to say about them a little bit later, but before I do, let's take a trip back to the 60s, to the start of their careers, and reflect on how far we've come. And then we'll hear from our Monash Health Board Chair, Deepak Songvi, with an important message.
Welcome to this significant event to recognize our wonderful Monash Health people. I am Deepak Sangvi, Chair of the Monash Health Board of Directors. I'd like to begin by acknowledging the traditional custodians of the land, the Wurundjeri and the Boomerang people, and pay my respects to them, their culture, and their elders past, present, and emerging. I'm pleased to be with you today to celebrate and acknowledge your years of service. Congratulations to you all. It has been a year like no other. As the health service responded to the COVID-19 pandemic, you have adapted continually. I'm proud of every member of our Monash Health team. You continue to deliver the best of care under the most challenging times. You have shown outstanding resilience, commitment, and dedication. Today's event will celebrate your incredible contribution. Each of you has a different role, whether it is greeting patients, keeping our health services clean, preparing meals, working in our labs, or delivering the best healthcare to our patients. You make a real difference in the lives of the real people. The news headlines focus on the big outcomes and big statistics. But every day across Monash Health, there are small acts of kindness and care. These acts makes all the difference to your patients and your colleagues. Working in health is like no other job, and by choosing to be here, you have shown you are committed and caring. As you continue your life journey, I hope you will reflect with pride on the difference you have made to people's lives. The difference often comes at the greatest time of need. I'm excited by the future and hope you are too. We are always looking to grow and improve our care to the community. We have the vision to be a leading teaching and research health service of international standing. I'm confident we will achieve that vision because of you. Enjoy your celebration. You have earned it.
As Deepak says, to deliver excellence in healthcare, we need people who share our vision. People like you who have shown years of commitment and dedication. All of you influence how a patient or a consumer feels when they are in our care and what they remember about their time with us. I want to mention Helen Gilbert, who started her Monash Health career as a lab scientist at the Queen Victoria Hospital on the same day as decimal currency was introduced in Australia, on Valentine's Day in 1966. And Marilyn Lewis, who in the same year answered an advertisement for a secretary at the Mordialloc Cheltenham Community Hospital and is still working at Moorabbin Hospital today. These are two of the longest serving employees in our health service has had the pleasure of recognising. These length of service events tell us a lot about our organisation. They tell us about our people and the intangible essence of a health service which offers so many experiences to grow, change and learn, and to challenge and be challenged, both personally and professionally. Over these 4 events, we had 2 last week and 2 this week. We'll hear from a nurse who's in charge and has worked the night shift at Dandenong ED for 35 years. A pharmacist with a focus on antimicrobial stewardship on secondment with the Doherty Institute. An outstanding neonatologist. A person who has helped her team safely navigate the cleaning and food services delivery during the pandemic and much more. A Casey Hospital volunteer of 15 years. A member of the Victorian Women's Honour Roll who has been guiding Victorian women's on care of their health for over 25 years. An ICU nurse manager who's turned his considerable skill and knowledge to help manage the flow of clinical products from Scoresby Distribution Centre to hospitals across the state, and of course, many, many more. We've always known that Monash Health is made up of many great people doing important work, but that has never been more obvious than during the pandemic. The challenges and the risks have brought to the fore everybody's strengths, skills, and expertise. In the past, the community might not have given much thought to the lab technicians or the pharmacists. They might not have thought about the employees who manage infection control or source PPE. They might not have thought too much about the cleaners. The COVID-19 pandemic has changed how we operate our health service and has affected us all personally and professionally. This includes tonight's event, which of course here we are running virtually to help keep everyone safe. Through the challenges we've faced this year, you've continued to adapt, innovate and deliver safe and high quality care. I'd like nothing more than to shake your hand, but that'll have to wait a little bit longer. This year, our daily work has been in the spotlight in so many different ways. The community tuned in to the work of hospitals and health services. The public was waiting every day to hear the infection numbers, wanting to know how many patients were in hospital, intensive care unit numbers, and how many more were on ventilators. How does contact tracing work? And how many more vaccines need to be delivered before we hit the all-important milestones? You have already shown how adaptable, flexible, resilient, and caring you are. Those characteristics are probably what drew you to the health sector in the first place, and a place like Monash Health. And while working during a pandemic is extraordinarily challenging, it is something that I think will strengthen you in so many different ways, and certainly something you and I will never forget. While the COVID response has dominated this year, Monash Health has continued to care for our other patients, as we always do. We've seen some exciting progress on some major projects. The Victorian Heart Hospital getting closer every day and due to completion next year. The government is committed to building a new facility at Kingston Centre, a new residential aged care facility. We've opened the new emergency department and dedicated children's emergency area at Monash Medical Centre and plan to fully complete it at the end of this year. Of course, we commissioned the new Casey Hospital Tower and the new intensive care unit, part of that exciting expansion project at Casey Hospital. But thank you for coming to work each day and serving our community. And in particular, thank you for choosing to work at Monash Health, choosing Monash Health to be your place of work. Before I introduce part of the executive team who'll be helping me during the event tonight, I'd also like to read out some comments about the volunteer we're acknowledging tonight for his 20 years of service, Les Hodgson. And the comments come from his team at the Equipment Services Department at Moorabbin Hospital. They had to say about Les. Les is the most wonderful, caring man who started working in equipment services more than 20 years ago. He attended each week to organise patient aids and equipment. He counted stock levels, sorted the storeroom, disposed of unwanted items, and did minor repairs. Les has a real joyful life, and his bright and bubbly personality is a gift to us all. He's been an integral part of the team, sharing stories about his love for his family and painting, singing and music. He is really supportive of his colleagues and the life of the party at all the social events. It's a great pleasure working with Les, and his contributions to the equipment services have been enormous. You can see Les up on the screen, and I hope you're watching, Les, and thank you from all of us. 20 years of volunteering is a wonderful contribution. So, it's not all just me talking tonight. To read the names of those being recognised for dedicated years of service, I'm joined by Professor Nick Freezer, the Director of the Monash Children's Hospital, Karen Lowe, our Executive Director of People and Culture, Associate Professor Georgia Soldatis, our Program Director of Acute, Subacute and Community Program, and Dr. Angela Julia, actually I think Associate Professor Angela Julia, who is our Chief Medical Officer. But to start, I'd like to ask Professor Freezer, our Program Director in the Children's Program, to announce our first group of 20-year length of service awards for employees. Over to you, Nick.
Thank you, Andrew. Good evening, everybody. I'm very pleased to be here this evening to celebrate your 20 years of dedicated service to Monash Health. Without you, we'd not be able to provide the excellence in patient care that we deliver to our community. The following volunteers and employees are celebrating 20 years of service at Monash Health. Esther Arons, Fathia Adam, Celeste Aguilera Mendoza, Michelle Allen, Christine Allen, Aubrey Almeida, Margarita Altclass, Tricia Anderson, Corinne Andrews, Rosalie Aquilon, Rosario Acamo, Alison Aguirre, Sarah Avery, Irene Bacco, Michelle Baker, Amanda Bard, Philip Barden, Kerry Barwick, Rosina Bednars, Christine Beggio, Louise Benton, Gail Berry, Amy Bland, Deborah Boland, Melissa Bonadeo, Meredith Bonifaci, Jessica Bonnet, Alison Bounds, Maria Braun, Karen Brewer, Isabel Brito, Veronica Brody, Cherie Brown, Sally Bullen, Rochelle Bunn, James Burns, James Cameron, Bianca Campbell, Marilyn Campbell, Adrienne Cashman, Damien Castanelli, Marina Corci, Nadia Kazal, Rosa Cerrone, Bessie Chan, Marina Chand, Sashi Chand, Bonnie Chow, Lin Chen, Wei Yu Chen, Anthony Chin, Julie Ann Clark, Jo Ann Clifford, Kimberly Clinton, and Amber Coleman. Thank you. Back to you, Andrew.
Thank you, Nick. As we move through tonight's ceremony, we'd like to welcome hearing from you on Slido. I'm sure many of you are familiar with Slido. To participate, go to Slido on your computer or phone and put in MHLOS 2021. Or you can find the details on our website or on the Facebook group. Our first question tonight is, you've travelled back in time to your first day at Monash Health. What would you tell yourself on that day? Remember, tell us your thoughts on Slido and I'll check in on them as we go and as we move through tonight's ceremony. Next up, I have the great pleasure in talking to Anita Lovegrove. Anita has played key roles at Monash Health over the past 20 years, including as an ICU nurse in nursing informatics and as a manager of infection prevention. She's also been involved in infection prevention plans for the capital projects, including the Monash Children's Hospital and the Monash Heart Hospital. Many of you at Clayton would know Anita because she may well have administered your flu vaccine at some time or another. Hello, Anita, and welcome.
Hello, Andrew. Good evening. Hello, everybody.
Interesting journey, Anita. Do you remember when you first started?
I do. I actually came to Monash, or Southern Health at the time, and joined the nurse bank about 20 years ago now, just looking for a new experience and fortunately for me, an opportunity presented itself in ICU to undertake the training in that program, and also to work in that unit, which was a fabulous experience. I particularly enjoyed the challenge of the patient-centred care, the collaborative care that we give, the total healthcare worker team that works together for these patients and include the family. And for me, for a learning perspective, it's a super learning supportive environment, most definitely. And we saw the expansion from 12 beds out to 20. And it's quite unique in so much as we had both an adult and paediatric combined unit, which was the only one in Victoria. So that presented variety and challenge every day for me, which I thoroughly enjoyed. And
which parts of the health service? So just ICU and infection prevention, Anita, or different spaces?
I had a little sojourn out into nursing informatics while I was sitting in ICU one day looking at the tea break, looking at the jobs available. Something came up with nursing informatics as maternity relief, and I thought, oh, that's a good idea. In a previous life, I'd actually been a NUM in a role and undertaken tertiary studies. And in that, I came across a module in nurse informatics, which sort of struck a chord with me, in so much as it was an opportunity to introduce computers to nursing and somehow document our work and actually give value and create a repository where we could actually extract data and have evidence-based practice. Because, as you know, nursing is very much manual work, and it's also a manual documentation system, which retrieval is very, very time consuming to be actually looking at any improvements in that place, and to actually look at our sort of achievements and goals and improvements that we could possibly make in that spot. But that was back.
Sorry.
No, I was going to say that was back in 1990, so it was a long time ago, and the vision then was really, I had very enthusiastic American and local educators in that space, and we obviously formed a computer group in nursing for Victoria. Then we went on to the National Informatics of Australia, and then we actually created the inaugural Health Informatics Society of Australia in 1993, which is fantastic. We were improving, but from my perspective, we were just doing the fringe work. We were assisting with the basically the efficiencies, the administrative burdens and things like that, but we standardised practice a little bit, but we weren't actually documenting our healthcare as a given, and compliance and standards, and actually measuring goals and seeking to make those gaps and improvements and outcomes.
You must have some amazing memories of all your years at Monash Health. I always think it's an unfair question to ask if you've got a particular favourite one, but I'm going to ask you, do you have a particular favourite one or something that comes to mind?
Moving on into infection prevention, because in another life I'd worked in an infectious diseases hospital, we knew this pandemic was coming at some point in time, and back in about 2008-9 we had the swine flu, which had a little bit of global movement but really didn't eventuate to anything. But that sort of started a lot of healthcare groups thinking about how they would manage in that space, and the Pharmacy Guild of Australia actually identified a large gap, and the Monash Infection Prevention team actually secured a tender in that process to go out and educate. So 2 former colleagues and myself actually got to go to every capital city and major community to actually educate. And again, how should we say, infection prevention strategies haven't changed. We go back to the basic hand hygiene, social distancing, cough etiquette, cleaning, and the basics. And it was fantastic. They actually, acknowledged there was a gap in their undergraduate curriculum that needed addressing. And we had the opportunity to look at their also business continuity plans and things. So it was quite interesting to come to the full circle of walking down the street into a local community pharmacy, knowing it's very much an essential service in this situation, and see all these elements put into place.
I'm sure you didn't need...
I've really enjoyed that.
I'm sure you didn't need border passes and face masks, though.
No.
Because you were travelling
But it was
around.
a novelty. No, not at all. But
Absolutely.
The novelty was introducing the face mask to so many people, and the complexities of popping it on was interesting. Yes.
Anita, congratulations. Thank you for your length of service and everything you've done at and with Monash Health and supporting your colleagues, and it sounds like the broader healthcare community. Thanks for joining us tonight.
Thank you for having me. Thank you.
So let me just jump to a couple of questions that have responses to my question and just general comments. So enjoy this wonderful organisation and what it has to offer. So many excellent opportunities and so many lovely people to meet along the way. I think we've just been chatting to one. It has been such an easy process and very welcoming. I did my midwifery training back in 1990 and also gave birth to my 2 children at Monash. So Monash is very much family to me and was so happy to come back to start working in the postnatal ward 20 years ago. I've worked in midwifery, but now I'm so lucky to be part of the COVID-19 immunisation team at the moment in the clinic. And maybe just one more for the moment. You and Monash Health will be linked for the next 20 years. You will make some incredible friends and have some very memorable experiences and opportunity. Signed, Catherine Cook. Thank you. Good ones. I'll come back to those in a minute. So now I'd like to invite Karen Lowe. Karen's the Executive Director of People and Culture, to announce our next round of 20-year length of service awards. Thanks, Karen.
Thank you, Andrew. And actually, firstly, I would just like to say thank you to all of our employees, but particularly these people that have been able to survive and manage and work through all the difficulties and the benefits of the 20 years working with Monash Health. It's a fabulous achievement. your commitment to our patients and our consumers, for me, is very humbling. You've supported them through very difficult times, but more importantly, you've supported our colleagues over many, many years. So my first and only thing that I really want to say is thank you for everything you've done, because without you, we would not have this organisation. So thank you very much for that. I'm actually having to work on 2 computers and my other computer's just failed on me, so excuse me for a moment. Completely failed on me. Excuse me. So I would like to now start to recognise the employees who've done 20 years service, an amazing and outstanding achievement. So firstly, Bernadette Colling, Catherine Cook, Margaret Cooper, Frank Crauken, Erica Cheek, Marcus Darm, Giacomo D'Amicchio, Karen Baritz, Lynette Davies, Irene Davison, Natasha De Oliveira, Lavinia De Silva, Pablita Dela Cruz, Jacinta Devitt, Anita Diane Duhunsky, I'm sorry if I've pronounced that incorrectly, Jacqueline Denaire, Armin Dernda, Bruce Duff, Angela Erganay, Bruce Hawaii, Catherine Evans, Hamida Felime, Dale Ferguson, Dale Philo, Andrea Fisher, Elizabeth Fivas, Meredith Fowles, and Claire Fredrickson. Robert Fryer, John Gall, Andrea Galutz, Josephine Galeen, Walter Gee, Dimitrios Gianos, Triasha Gibney, Amanda Giles, Teresa Gilly, Messeret Gizwa, Bashir Gundal, Celise Grizel, Josephine Gumwagan, Josephine Gurin, Chloe Hall, Nerida Hand, Debbie Harfield, Sally Haskett, Wendy Hayes, Jacqueline Harrington, Louise Hewitt, Emma Hoskin, Sedina Auer, Tony Hunter Miller, Emma Hurley, Tan Huwin, and Lulu Ibrahim. Thank you so much for your service. Thank you for everything you've done for our patients, our consumers, and our colleagues. And please enjoy the celebration of your service. Thank you.
Thanks, Karen. So let's just go back to that question. And the first commentary is, it's just disappeared from me. It was, I'm watching from New York. Good on your mum. I'll come back to that in a minute. So I'd now like to welcome back Nick Freezer to announce the next group of 20-year award employees. Thanks, Nick.
Okay, thanks, Andrew. Rebecca Ioannidis, Leonie Irwin, Melina Ivanovich, Jennifer Jacobs, Shirley James, Kortu Jara, Mary Rose Jaspers, Lucy Johnston, Lynette Jorison, Prima Joseph, Atasam Carmel, Rosemarie Korshal, Jennifer Kane, Kathleen Kempthorne, Rosalind Kennedy, Lisa Kenny, Susan Kerwin, Jill King, Angela Kingsford, Kathleen Knight, Andre Kogan, Sandra Kordich, Danka Kovacevic, Manju Kumar, Kylie Levy, Jonathan Lee, Angela Leonard, Michelle Letty, Anthony Lewis, Jun Lee, Kerry Linton, May Lowe, Catherine Longfield, Anita Lovegrove, Linda Lucas, Chu Chu Lewin, Hazel Macapagal, Catherine McDermott, Kate McDermott, Elizabeth Mackey, Linda Matterford, Kamini Maharaji, Pearl Ma, Thomas Manolitzis, Stavrula Mantis, Catherine Marshall, Julie Martin, Amanda Martin, Arlene McDonald, Charlie McGeish, Edith McLaren, Vicky McLeod, Elizabeth McLeod, or Liz McLeod, Louisa Medeiros Santos, Kristen Mellett, Amila Menon, and Suzanne Mills. So, back to you, Andrew.
Thanks, Nick. And congratulations, of course, everyone. So let's just go back to a few questions. So that one was, congratulations, Mum. I'm watching from New York. I'm not sure who Mum is, but I'm sure Mum knows. What a wonderful milestone to work for or volunteer for 20 or more years. Thank you for your years of service, everyone. Congratulations and best wishes, Les. Thank you for your contribution. There was never a dull moment working with you, Les. What a fantastic person, Les. It's inspiring to hear about our volunteers and the way they add to the fabric of our service. To the younger me, there are many amazing and caring people who already work here. You're about to become one of them. That's a good one. Oh, congratulations, Anita, one of the great ones. Thank you. Bernadette McCulloch must be commended for her dedication and commitment to the care of women and being part of her amazing fetal monitoring team. Congratulations, Catherine Cook. You represent yourself and Monash Health proudly and a thorough professional. Watching with pride from Tasmania. So we're in Tasmania and New York. What a fabulous event. It's tough not being able to gather together in person, but this is a good second best under the circumstances. We've got a response from Mum. Thank you, Raiden. Staying up late, 1:30 a.m. in New York to share the milestone with me. Love you, Mum. So proud of you, Jason Moss, Mum and Dad, long time and dedicated. Congratulations on your continued passion. This is from family, commitment and service to your patients, medical science and research, Krishna Vedadi. We are very proud of you. That's from Krishna's family. Okay, thank you for that. So the next question that I think that I want to leave you with is what Monash Health moment lives in your memory? So a bit what I asked Anita, a bit unfair to try and think of one, but maybe it's the first one that comes to mind. Professor Beverly Vollenhoven is AM, is head of gynecology at Monash Health, the Carl Wood Chair of Obstetrics and Gynecology at Monash University, and a clinician at Monash IVF, a very busy person. Beverly has helped many women achieve longed-for pregnancy and has improved the rate of surgical pregnancies in older women. In her 25 years at Monash Health, Beverly has overseen the growth of Victoria's largest and busiest gynecology service. She has helped forge new pathways for women in medicine. She was the first obstetrics and gynecology trainee in Victoria to take maternity leave and was also the first female O&G trainee in Victoria to be awarded a PhD. Beverly was inducted into the Victorian Roll of Women in 2019 and has this year received the Member for the Order of Australia Award for significant service to medical education and research, to endocrinology and to women's health. Welcome, Beverly. No longer in the car, so you made it home.
Thank you, Andrew. Yes, I did, after a busy day.
And I'm a bit tired from reading all of that, Beverly. Do you remember when you first started in clinical practice or at Monash Health? Whereabouts did you train?
So I actually trained at, I started off at Queen Vic. So I've been at Monash Health for longer than 25 years, but this is 25 years of actual continued service.
Right.
So I started off at Queen Vic as an intern. and then moved over to Monash Medical Centre when it moved, which I think was in 1986 from memory.
Yeah, about that.
Memory might not serve me so well. Yeah, and then I actually started my training at Monash Medical Centre in obstetrics and gynecology.
So how many years in total is it in public health, Beverly?
So I've been in public health, well, probably since I was an intern, really.
Right.
So since 1985.
So what's that?
Yeah.
You're gonna get me to do my maths. So it's more like
Well, I'm not
35
gonna do
years,
it.
not 25.
Yes, it's a long time.
Well, we could
I've
just
been
call this.
overseas in that time as well.
We could just call this your 35-year award. But Beverly, very busy. It's slightly frightening to think that in that short period of time that you were the first O&G person to take maternity leave in such a, as I said, such a recent time in our history.
Yeah.
Was that,
Yes,
was that a struggle, or is there a story around that?
Yeah, there is actually. There's quite a good story around it. It was quite a struggle to get approval to do it. And one of my friends now, who was the training supervisor at that time, said to some other people who were in the training committee, she's never going to come back. It's such a waste. We've given her a training position, and of course I came back. And the funny thing is I ended up being his boss. So that is a different story. But
Yes.
look, it's been a really good time that I've had at Monash Health. And so, yes, I'm happy to continue my service there for who knows how long.
And you've just picked up a new role, Beverly. Can you tell us a bit about that?
Yes, so now just very recently appointed the Carl Wood Chair of Obstetrics and Gynecology for the university, which is great because I'm the first woman in that role. There have been 3 previous chairs, Carl Wood, David Healy, and most recently Ewan Wallace. So big shoes to fill. And in that role, I'm going to also be in charge, I don't want to say in charge, but in charge, for want of a better term, I guess, of research in obstetrics and gynecology at Monash Health itself. And so what I want to do, and which I've started already, is to try and move our clinicians and our scientists closer together so that we have good interaction between the two of us, because the more interaction we have with scientists and vice versa, the better our research is going to be, and the more appropriate our research is going to be. So that's really what my aim is going to be.
And Beverly, as I keep saying, it's unfair to ask, but of course I will, which is, do you have a particular favourite memory that you can share with us?
Well, I think that memory of that training supervisor, I quite like that. But
Yeah.
look, I think I don't have one particular memory, but I think what I'm very happy about that has happened in the gynecology team particularly is that we've become extremely close, and we're a very collegiate group, and we really look after each other. And I think COVID, for all its horrible, all the horrible stuff that's happened with COVID, the benefit for our team is that it's brought us a lot closer together. So we look out for each other much more than we did before. And I'm really proud to be part of that group, actually, because I think, we really work very, very well together and for the betterment of our patients, obviously.
Beverly, thanks for joining us tonight, and congratulations, and lots of exciting things still happening in gynecology, and a lot more to do.
Thank you very much, Andrew. Thank you.
Thank you. So I'd now like to invite Associate Professor Georgia Soldatis, who's the Program Director for our acute, subacute and community program, to announce the next group of 20-year award recipients. Over to you, Georgia.
Thanks very much, Andrew. So it's my absolute pleasure and privilege to be here this evening to share in the celebration and acknowledgement of our 20-year length of stay award recipients. And the list includes Sandy Mackayes, Louise Mollett, Carolyn Montague, Tanya Moore, Andrew Moore, Tammy Morris, Jason Moss, Helen Masasa, Diane Newbury, Karen Newman, Melinda Newton, Sandra Nichols, Megan Nisbet, Catherine Nosh, Yuri Okazaki, Janet Olayimi, Deborah Lynn Ortolan, Elise Ozols, Carmen Parker, Kasarina Patitucci, Scott Pearce, Rachel Lee Pegler, Melissa Percy, Graham Pickering, Chris Plakiotis, Emily Plaisher, Kevin Polkinghorn, Peter Poon, Yakita Powley, Carolyn Poyser, Deborah Price, Helen Psychogios, Sarah Ramasamy, Lenora Richardson, Fiona Ridderford, Anna Ring, Andrew Robinson, Alyssa Rockman, Maria Rozic, Fatima Salah Musi, Widad Salim, Sarah Sammy, Sandra Saunders, Graham Saunders, Bronwyn Scaletti, Anne Scully, Jennifer Sequira, Ashik Sethi, Seja Shaji, Nazreen Shamsi, Heather Shamsatlahi, Chen Shen, Diana Simeone, Anthony Sigarasa, Nada Sirinich, and Eveline Sivaganthan. So Andrew, that concludes my list of recipients. Congratulations to each and every one of you, and many thanks for your contribution over the last 20 years.
Thank you, Georgia. So let's take some answers to that question about what Monash Health moment lives in your memory. First one is from Professor Julian Smith, our head of cardiothoracic surgeon and a proud Monash Health employee for 20 years. Julian's memory: the weekend before the 2014 Victorian state election, when Daniel Andrews stood in a Monash Medical Centre cardiac catheterisation laboratory and promised that the Victorian Heart Hospital would be built under a Labor government if elected. And the rest is history, and we're not too far away, Julian, are we? More of a personal moment, but the best memory of all, the birth of my son 6.5 years ago. Being a patient and seeing everything from the other side, it was a wonderful experience, and I was treated so beautifully by the staff of Monash Health. Y2K. I was working in ICU night duty as an associate nurse manager. Had bird ventilators in case of power failure. Double staff. We ended up having a great night overall. I still remember that night very well. Being part of the opening of the first part of the new ED earlier this year and the opening of the second part next month. Being part of administering vaccinations to the staff and community this year. Helping to lead Monash Newborn to move our unit and all the babies into Monash Children's Hospital. Working together to keep each other and our community safe during the pandemic. Just a moment of pride. And then finally, I'll never be able to forget this pandemic, but more importantly, the response of everyone at Monash Health to protect our community and stick together as a team. Such a tough couple of years, but even tougher Monash Health teams. We took the opportunity to ask a few other people, some of our other long-serving employees, a few questions about their experience at Monash Health. And this is what they had to say.
I would describe my role as running the operations of Monash Children's Hospital together with the various leaders of the organisation, and that's to ensure that we provide the best possible care to our children and their families.
I would explain my role as trying to change Monash Health in a way that we can respond better to people who are experiencing family violence.
I established the early neurodevelopment clinic at Monash, where we actually diagnose our sick babies with conditions like cerebral palsy at a very early age. That gives us the opportunity to help these babies and families achieve their best potential going forward.
The way I describe my work to others is that my passion is with children. For the last couple of years, I've been working with the babies in the children's in the canopy ward.
My main job in Monash Health is to photograph patients and their medical conditions as part of their treatment or for teaching or research.
I've loved nursing for 30 years and it's something that I love because I can make a difference. I would say some of my favourite memories come from the paediatric ED. I have lots of little children who would be so upset, but when you join them, all of a sudden they calm down, they become happy. I've even sometimes had a little sing or a little dance with children, nursery rhymes, and all of a sudden you make their day.
My favourite memory is the silly times when people were celebrating an event or getting together.
One was as a student when I cared for a gentleman who had suffered a stroke and he was unable to speak. As a result, he eventually was able to say, I will walk out of here, and I had the privilege of walking him out of the hospital on discharge.
My favourite memory at Monash is the birth of my own child 16 years ago. Monash is a very big place with a lot of departments and a lot of other facilities on site. So please go exploring Monash and try to talk to as many people as you can and work with them. It's a fantastic place to be.
Embrace new changes and challenges and opportunities.
Become a friend of a ward clerk because they know the ins and outs of the hospital.
That's a huge question. I'm most grateful for the people I've worked with. I've had some amazing leaders, mentors and teams that I've worked with. And I'm most proud of the care that we provide to our patients.
I guess I'm most grateful for the stimulation of the environment and the mental challenge that it's given us working here. Because it's so challenging, it's also very stimulating.
Over my time here at Monash, I'm most grateful of the support and respect that I've received as a professional, that I'm part of a team and that I'm involved with teamwork. It's fantastic.
I don't think I ever dreamed that the pandemic would be as severe, nor would it go on for such a huge amount of time as it has.
What it's taught me is how vulnerable we actually are, but it's also taught me how flexible, agile and resilient we can and are being.
It just goes to show if we work together, we deliver awesome outcomes that affect the whole community.
COVID has taught us to be flexible, to be respectful and to be as patient as possible.
It has taught me quite a bit about life, and even at my age.
There's not one word I could describe my colleagues. They're awesome, they're inspiring, and the support I receive from them every day, both on a professional and a personal level, I'm really grateful for.
They are dynamic.
I would say they are very friendly.
The one word I would use to describe my colleagues is dedicated, but I think that dedication shows all the time.
One word I would describe my colleagues is brilliant. What brings me back to work every day and to Monash Health is that I truly believe we are making a difference in the patients that we care for and their families.
One of the special things about Monash is that I not only get to practice the medicine, the education and research I am so passionate about, but I also work with my wife, Associate Professor Arunas Kumar, who is also a partner in crime. So I'm really privileged to work alongside my wife in this Monash happy family.
The children are the ones who are important, and if I can make them happy, make them smile and laugh, this is all I can ask, and I go home happy.
Great to hear those memories. I'd now like to introduce Dr. Anjali Julia, Chief Medical Officer, to announce the final group of 20-year awards for our employees. Anjali, welcome and thank you.
Thank you, Andrew. It is indeed an honor and a privilege to be part of this event, celebrating and recognizing people who have achieved very significant milestones in their service at Monash Health. You form part of the fabric of this organization and actually make the organization what it is, which is a center of excellence. So, continuing with the list of our 20-year employees, Wendy Smith, Julian Smith, Janice Smithson, Elizabeth Somerville, Claire Sterling, Richard Stridberg, Andrew Strickland, Sarah Swinnerton, Shireen Dabatai, Rosalia Tobias, Jane Tan, Pek San Tan, Denise Tellas, Kengiswari Davendran, Julie Thomas, Ellery Thomas Andrea, Jacqueline Thompson, Melanie Toy Liang, Tai Tran, Tasmin Trimnell, Melissa Sakiris, Marie Turner, Maja Venica, Tomai Valsamis, Elizabeth Van Diemen, Josephine Van Dort, Dinia Vaniher, Emma Bash, Anna Vasquez, Nicole Verginis, Robin Visser, Tanya Salupski, Michelle Wagner, Sandra Wallace, Raylene Walsh, Diane Walters, Marie Verushak, Hilda Victor, Baoling Wen, Kelly Ann Whitaker, Deborah Wilson, Malolita Windrum, Michelle Wood, Melissa Woods, Rebecca Woods, Shiri Woodyard, Louise Wright, Marie Young, Howard Zema, Mary Jo, Robert Zirafi. Congratulations on 20 years. Enjoy your day. Thank you. Back to you, Andrew.
Thanks, Anjali. So just to round off some of those questions and comments actually from last time. Beverly, you're just so inspiring. How do you do it all? The women of Victoria salute and thank you. Beverly, you're such a trailblazer and inspiration to women and men in the medical profession and beyond. And you're a shining light, Beverly. Thank you. One of my proudest moments was moving to the new DSU at Casey Hospital. What a team. Thanks from Megan Torelli. I have awesome co-workers. They are sometimes the reason you regret to call in sick to work or reason you do a double shift. Such beautiful reflections video. Thank you. Great responses. And my next question, my last question for you tonight, your last bit of homework, is what do you still want to achieve at Monash Health? And Julian, yes, opening the Victorian Heart Hospital, I'm with you there. But I'm sure there's a few others. I'd now like to welcome Karen Lowe back, who will announce the first group of 25-year awards for our employees. Thanks, Karen.
Thanks, Andrew. And gosh, wasn't that fabulous listening to those reflections? I can remember I've only been with Monash for 5 years, and my first thought was, how do I get a pen? But I need to reflect more on that because those reflections from our group of employees earlier were just so fabulous, weren't they? So to thank our amazing employees and who have supported our patients and colleagues over 25 years, let me start with Daniel Archer, David Armstrong, Nicole Boyle, Kelly Barrett, Gary Barron, Anne Barry, Samantha Battistello, William Beasley, Jennifer Best, Juliette Bibby, Thomas Blasevic, Jade Bocalar Corbus, Pauline Branley, Kim Bruin, Deborah Bridgeford, Fiona Brown, Quan Chan, Jenny Kiam, Kun Chin, Ao Chung Ching, Michelle Clark, Kylie Comrie, Cassandra Croning, Melissa Cunningham, Mary Daly, Sari Davies, Bruce Dearness, Marisa Dunapala, Michelle Drain, Chandaram D, Mary Dyson, Joanne Evans, Vasiliki Faturaris, Marija Favaris, Marcel Favilla, Sylvia Felmingham, Sudino Fernando, Marie Fisher, Suzanne Fleming, Siciliano Flores, Glenys Foote, Robin Gardner, Kirsten Garner, Michael Gordon, Cheryl Gregg, Susan Hanaheim, Margaret Haley, Kayleen Hay, Elisa Hernandez, Kelvin Hicks, Anna Hohenhaas, Kirsten Holden, Deborah Hoskins, Mark Hurley, Tuan Kamore, Michelle Kelly. Thanks, Andrew, and back to you.
Thank you, Karen. To the next person I get the pleasure of having a chat with tonight is Dr. Adam West. Adam is the Director of Paediatric Emergency Medicine and has been with Monash Health for 25 years, having completed his medical degree at Monash University. In 2003, he completed his training as an emergency physician. And I understand, Adam, your view is the breadth of opportunities at Monash have given you great experience working in many departments over the health service, an amazing experience for an emergency physician trainee seeking to understand acute hospital care. Since completing his training, Adam's worked as a consultant emergency physician in both Monash Medical Centre and KCEDs. Over the last 12 years, he's been able to focus his work in the emergency department on paediatric care and been the head of paediatric emergency since 2012. Adam's also an adjunct senior lecturer with Monash University, allowing him to contribute and support not only his own research, but that of the established and emerging researchers in paediatric emergency. Great introduction. Welcome, Adam. How are you doing?
Yeah, thanks, Andrew. I'm doing great. It's an exciting time.
It's a very exciting time. You know what? A few years in the planning, Adam, to sort of hopefully get your own space to deliver paediatric emergency care. Not far away now.
No, that's right. It's been that's been an exciting journey. Perhaps in hindsight, building an emergency department during the pandemic's not the best idea, but you know, we roll with the punches sometimes. But it's been it's great. In fact, one of the most exciting moments I've had was opening the new emergency department earlier this year. To spend all that time with the architects and all the stakeholders, putting the ideas together and creating a space that is designed for the families and children that we look after. To see that in the world, it was quite a moving moment.
So you trained,
and I know that
sorry, you go.
The rest of the department will look amazing when it's finished later this year and into next year.
You trained at Monash Health and Monash Uni, is that right?
That's right. That's right.
And you must have had some amazing, some interesting and some amazing mentors and supervisors during that time. Is there anyone that particularly jumps out?
That's a great question. I've worked with a number of very inspiring people in the time that I've worked at Monash at different levels, both within my specialty and outside. Tony Cambarakis, who's you may know, the Director of Medical Services at the Alfred now, was my immediate boss in the emergency department for some time as the head of the unit there. But I've worked with George Breitberg, who's another very prominent emergency physician that I've drawn a lot of inspiration from. And I've had the opportunity of working with a number of people who are now chief executives at other health services. So it's been great to have that experience working with those people and understanding how our health system works.
And a great opportunity to take all of that and collect it and package it in terms of how you lead the department, and also, I guess, how you assist our young trainees today. Adam.
That's right. One of the important jobs that we have is training people in paediatric emergency and emergency medicine. We have a lot of medical students who spend time with us, and it's really rewarding to see those students progress to junior doctors and then choose specialties. We've had a number of people who have joined emergency and cite their paediatric emergency experience as one of the deciding factors that led them into the specialty, and that's a very rewarding thing to hear.
And do you have a favourite recollection, Adam, that you want to share with us?
Look, the most recent one was opening the new emergency department.
Yep.
You know, we perhaps didn't have quite the ceremony that we might otherwise have had earlier in the year, but that was a lot of many years of work, as you'll know, designing and then waiting for it to be built. And, you know, it's still not reached its final configuration, but we're nearly there, and it's going to be great to see how that space works and to spend time in it with the patients and the staff.
Excitingly close, Adam. I think we're going to try and open it in the next month or two, aren't we?
That's right. That's right.
And let's hope we've got a nice big ribbon to cut now that we're starting to get these restrictions lifted.
That's right.
Adam, thanks for joining us, and congratulations. And I really look forward to the next few months and the next few years working alongside you.
Thanks, Andrew.
So question was, what do you still want to achieve at Monash Health? I think Adam's was to open the emergency department, but I'm sure that's just the next couple of months, Adam. But to continue to serve our community and colleagues and see them through the end of the pandemic. So very exciting, and also 45 years of service from Varna. So yeah, some good goals there. So I'd now like to invite Georgia Soldatis back to announce the last group of 25-year award recipients. Thanks, Georgia.
Thanks, Andrew. So the next group of recipients include Ezard Keskik, Kerry Knight, Vesna Kovac, Gillian Ledeck, Stephen Lim, Kee Liu, Julie Lustig, Sally Lyons, Stacey Matheson, Claire McAvaney, Jacqueline McCall, Bernadette McCulloch, Mavis McFarland, Sarah McGregor, Kelly McIntosh, Virginia McKenna, Louise McMeekin, Elham Mondus, Antonio Mosca, Fiona Nicholson, Amanda Oddy, Anna Ottenfeld, Xiao Pang, Varna Papasimeon, Lydia Parenti, Aradna Pathic, Andrea Pierce, Vanessa Painenborg, Karen Riccioni, Michael Rogers, David Ross, Mark Rudelick, Susan Ryan, Annalise Scarman, Anna Schlegel, Linda Sincock, Mary Louise Smith, Sarah Smith, Elizabeth Stevens, Jeffrey Sutton, Stephen Tam, Alan Thompson, Megan Torelli, Andrea Treweek, Janet Tracisi, Maria Tsitsaris, Krishna Vidadi, Deborah Vandersweep, Rosemary Vagina, Beverly Vollenhoven, Denise Wayne, Marianne Watts, Adam West, Jodie White, Tanya Williamson, Virginia Wright, Monica Wise, and Heather Zeckler. Congratulations to you all on what is really a remarkable achievement. We're incredibly grateful for your outstanding contribution to Monash Health over the last 25 years.
Thanks, Georgia. Thank you, Georgia. Final two comments for the night were, Bev, I remember you as a resident, and thank you, Adam, for everything you and the team do. My daughter has been through the ED a few times, and even the older premises got wonderful treatment and a great reflection. I always think, despite our environment, our teams, whether they be our cleaners, our PSAs, our pharmacists, allied health, doctors, nurses, deliver excellent care, and creating these new spaces like the ED, like the Heart Hospital, and many others are really about lifting our environment and providing a much richer experience for our patients and even better care. So that was 391 people we spoke to or heard from tonight. This year we've recognised over 1,500 people for reaching milestone lengths of service at Monash Health. I want to thank everyone we've recognised tonight for their extraordinary dedication to our community, to your colleagues, and to service delivery at Monash Health. I hope you're as proud of your remarkable contribution as I am, our board and executive team are. I want to now leave you with a special short video to say goodnight. I reached out to a number of people to see if they wanted to say thank you to Monash Health and recognise your achievements. And we got inundated by great response. And I want to share some of those thank yous with you now. I'm going to say goodnight. Thank you for joining us, and we'll end on this, I think, fantastic recognition and salute to you all at Monash Health.
On behalf of our government and every single Victorian, I'd like to send my sincere thanks to everyone over at Monash Health. From our frontline medical and nursing staff to those in the back office, the work you do every single day is the very reason Victorians are getting back to the things they love and have missed so much. Over the last 20 months, you've all had to give so much of yourselves, whether it's wearing PPE from head to toe, working back-to-back shifts, or missing out on time with family. You have sacrificed so much in the service of others. Now, I know that none of this has been easy, but please be certain that we are all so grateful for everything that you've done, for everything that you've given to keep our state safe. Thank you.
What a year it's been. Thank you to the entire Monash Health team for your amazing hard work.
Just wanted to say a huge thanks to all the hard work that Monash Health staff, the doctors, nurses and the many others have been doing during this pandemic and will continue to do in the difficult weeks and months ahead. You guys are just incredible.
Thank you to all employees at Monash Health. Thank you for your hard work and dedication shown to all the patients you have cared for with COVID-19 over the last 2 years. My work with Monash Health has shown that the employees are fantastic collaborators, they're can-do people, and they're excellent team players as well.
Monash Health was the first health service in the country to diagnose and treat a COVID-19 patient in Australia. And since that time, you have been at the forefront of our COVID response, looking after patients, responding to significant outbreaks, but also looking after all the other amazing requirements of the people during this pandemic. Monash is an extraordinary health service. Its staff are dedicated, well connected to the community, and you've done so much for our nation. Thank you.
You are all truly extraordinary. So both personally and on behalf of everyone here at the department, thank you. To each and every one of you for everything that you've been doing for our community for so long now. Your skill, your expertise, and above all else, your kindness have kept Victorians safe.
Thank you to all Monash Health staff for what's been an incredibly challenging year this year.
To the whole team at Monash Health, just a massive thank you, not only for being part of vaccinating 5.3 million Victorians, but for the care and passion and dedication you show in everything you do every single day. At a personal level, thank you for vaccinating not only my wife, my 2 children, but also myself, and every encounter I've had with your amazing team has just filled me with so much warmth and delight.
On behalf of your colleagues at Jessie McPherson Private Hospital, I'd like to say thank you for your dedication and support throughout this past year. Especially want to thank the many Monash Health teams that have supported and partnered with us in delivering excellent private hospital care.
I am proud of the Monash Health community team's response during COVID, caring for some of the most vulnerable people in our community. This shows great dedication to helping people to live their best lives.
Thank you to all employees at Monash Health. I'm so impressed with your dedication and teamwork.
What we've achieved has been extraordinary in how we've cared for all of those who need our help in this most challenging of time.
Your dedication and commitment to providing care, support and comfort for our patients is so appreciated by our patients and particularly by your colleagues.
More recently, my parents acquired COVID and were monitored by Monash Health staff. The care provided to my parents was second to none. I also had my son in for a broken finger a few months ago, and the bedside manner of all staff was exemplary. I'm proud to be a part of, and it is times like these that remind me of why I choose to spend my days at Monash Health. I'm very proud of you and this organisation. Thank you.
A million thanks to our fabulous Monash Health community. Your flexibility, agility and capability to work through difficult times is absolutely awe-inspiring.
What's been most outstanding for me about Monash's response is our ability to adapt to the constant nature and changing nature of this pandemic. We now have such a pride in our organisation because of what we've been able to do and how we've been able to contribute and how we've protected our community. So thank you all.
Unexpectedly, you cared for my father in the final days of his life. I will be forever grateful for the professionalism, care and kindness you showed Dad and my family. To work with you, to call you my colleagues over the course of the pandemic has been an immense privilege.
I would like to thank the entire financial services, procurement and logistics team for continuing to service the entire organisation. In particular, to warehouse and deliver PPE across the entire state of Victoria. They've shown a fantastic resilience and determination to get the job done. Thank you.
Congratulations, and thank you very, very much to all of you receiving awards, but to all the nurses and midwives at Monash Health, a very big thank you.
You should take great pride in the powerful impact that you have made to the communities we serve.
You've been amazing in the way you've come together, always showing up, always willing to work outside your comfort zone, and always being there for your patients and colleagues.
Be proud to be a staff member at Monash Health because we are very proud of you.
I'm grateful for the teamship that I've seen and most proud of how we have worked together with respect and kindness.
I would like to thank you all for all your hard work, flexibility and adaptability, professionalism and kindness that you have not only shown to our patients, but also to each other. I am very proud of the can-do attitude from everyone, without which we could not have achieved the great things I see every day.
I just want to express my enormous gratitude for all the work you've done, especially in this last year, but really over a long period of time. It's been an extraordinary effort. It continues to be an extraordinary effort. I think those who aren't there at the front line don't understand just how relentless and challenging it has been and continues to be. Thank you so much for all that work. You've got us to this point in time. You'll get us through some challenging days ahead, but hopefully we're looking at 2022 where we can all look back with enormous pride on what's been achieved, the lives saved, the care that's been given, and you are absolutely at the centre of that, so well done. And again, thanks from me and the entire public health team. Cheers.
Thank you for all joining together to support each other in the last 18 months. It's been a huge journey. and I'm very proud to be working with every one of you.
I really wanted to call out and thank all of you for the extraordinary work you've been doing. Your resilience, your professionalism, your patience, and willingness to be flexible and be part of the team.
It has been a year like no other. As the health service responded to the COVID-19 pandemic, you have adapted continually. I'm proud of every member of our Monash Health team. You continue to deliver the best of care under the most challenging times.
Thank you.
Thank you.
Thank you from the library.
Thank you.
Thank you.
Thank you.
And thank you for the commitment that you have shown to the people